Before blood tests, you must never do these 5 things. Most heart specialists warn seniors. If you're over 60 and your last blood test showed alarming results that shocked both you and your doctor, the problem might not be your health. It could be what you did the night before. Last month, 73-year-old Ruby received terrifying cholesterol numbers that had her doctor reaching for his prescription pad, until they discovered she'd made one simple mistake that threw off her entire test. Studies show that 40% of seniors unknowingly sabotage their blood work results, leading to false diagnoses and unnecessary medications. The mistake Ruby made? It's something 8 out of 10 people do without thinking, and it could be putting your health at serious risk. Today, I'm going to reveal the 5 critical mistakes that can completely destroy the accuracy of your blood tests. Mistakes that are especially dangerous if you're over 60. You'll discover why these errors can lead to false heart disease diagnoses, unnecessary cholesterol medications, and missed health conditions that actually need treatment. I'll show you the exact timeline of what to avoid before your next blood draw, the shocking supplement that can make your thyroid look diseased when it's perfectly healthy, and the common nighttime habit that sent one senior to the emergency room with fake kidney failure results. By the end of this video, you'll know exactly how to prepare for blood tests to get the most accurate results possible. Results that could literally save your life. If you're serious about getting reliable health information tailored specifically for seniors, make sure to subscribe and ring that notification bell. Trust me, mistake number 3 will absolutely shock you. I've seen nurses make this error, and it nearly cost someone their life. 1. The midnight snack trap. Let's start with the mistake that catches more seniors than any other, the midnight snack trap. Now, you might think having just a small bite before bed won't hurt anything, but when you're over 60, your metabolism works completely differently than it did when you were younger. Meet Diane, a 68-year-old retired teacher who prided herself on healthy eating. She had her annual physical scheduled and knew she needed to fast, so she ate a light dinner at 6 in the evening. But around 11 at night, while watching her evening shows, she felt a little hungry and grabbed just 2 small crackers with a tiny bit of cheese. It's barely anything, she thought. But here's what happened. As we age, our digestive system slows down dramatically. What takes a 30-year-old body 4 to 6 hours to process can take a senior's body 12 to 14 hours. Those innocent crackers were still affecting her blood sugar and fat levels during her 8 o'clock blood draw. The American Heart Association specifically warns that seniors need longer fasting periods because our insulin sensitivity decreases with age. Even sugar-free items can trigger responses. That sugar-free gum you chewed while driving to the lab? It contains sorbitol, which can elevate glucose readings. The coffee creamer you forgot about? Just 1 tablespoon can spike triglycerides for hours. Here are the hidden culprits that seem harmless but wreck blood tests. Breath mints, cough drops, liquid medications with sugar bases, even some toothpastes if you swallow residue. Vitamins taken with breakfast, they often contain sugars or are processed with your food, affecting multiple readings. The safe rule for seniors, absolutely nothing except plain water for 12 full hours before your test. Not 8 hours like younger people, 12 hours. Set an alarm, mark your calendar, do whatever it takes to remember this. Have you ever made the midnight snack mistake before a blood test? Share your story in the comments. You might save someone else from a false diagnosis. Now let's talk about mistake number 2. And well, this one trips up our most health-conscious seniors. It's called the exercise enthusiast's error. And it can make your heart and kidneys look like they're failing when they're actually perfectly healthy. Charles, a 71-year-old former marathon runner, maintains his fitness religiously. Every Tuesday and Thursday, he does his full workout routine, 45 minutes on the treadmill, weight training and swimming laps. His blood test was scheduled for Friday morning, and he figured his Thursday workout would show how healthy he was. The truth? Charles's body was simply recovering from his workout. But here's what most people don't understand about senior physiology. After age 60, our muscle recovery time doubles. The enzymes and waste products from exercise stay elevated in our bloodstream much longer than they do in younger people. When you exercise vigorously, your muscles release creatine kinase, an enzyme that in high amounts can mimic the signs of a heart attack. Your kidneys work overtime to filter exercise byproducts, temporarily elevating creatinine levels that suggest kidney disease. Inflammatory markers spike as your body repairs microscopic muscle tears. Normal for exercise recovery, but alarming on a blood test. The exercise effect lasts 24 to 48 hours in seniors, sometimes even longer. That gentle yoga class might seem harmless, but even stretching can affect certain enzyme levels. Gardening, heavy housework, playing with grandchildren, all of these activities can skew your results. Here's what counts as vigorous activity to avoid 48 hours before testing. Anything that makes you breathe hard, sweat, or feel sore afterward. This includes resistance training, jogging, competitive sports, heavy lifting, aggressive cleaning, or yard work. What's safe? Gentle walking, light stretching, normal daily activities like cooking or shopping. The key is avoiding anything that challenges your muscles or cardiovascular system. I've seen too many active seniors get false health scares because they didn't know about the 48-hour rule. Don't let your commitment to fitness accidentally sabotage your health monitoring. What's your regular exercise routine? Let us know in the comments if you've ever had surprising blood test results after a workout. Mistake number 3 is going to shock you because it seems completely logical, but it's actually dangerous. It's the hydration deception. And even medical professionals sometimes get this wrong. Meet Louise, a 69-year-old grandmother who was preparing for comprehensive blood work to check her heart and kidney function. She'd heard that dehydration could affect test results, so she decided to be extra careful. Starting 2 days before her test, she drank water constantly, finishing 3 large water bottles each day, plus her usual coffee and tea. She figured more water meant better, clearer results. The real problem? Louise had literally diluted her blood by overhydrating. This condition, called dilutional hyponatremia, is especially dangerous for seniors because our kidneys become less efficient at regulating fluid balance as we age. Here's the science. When you drink excessive amounts of water, your blood becomes diluted, throwing off the concentration of virtually every substance your doctor needs to measure. Sodium, potassium, protein levels, even cholesterol readings can appear falsely low. On the flip side, dehydration concentrates everything, making normal levels appear dangerously high. Seniors face a double challenge with hydration. Our thirst sensation diminishes with age, so we often don't drink enough water normally. But our kidneys also become less efficient at concentrating urine, meaning we're more susceptible to both dehydration and overhydration effects. The dehydration trap is just as dangerous. When you're dehydrated, your blood becomes concentrated. A cholesterol level of 200 might spike to 260 simply because there's less fluid in your bloodstream. Kidney function markers like creatinine appear elevated, suggesting kidney disease when your kidneys are actually working fine. They're just processing thicker blood. Here's the perfect hydration strategy for seniors before blood tests. Maintain your normal fluid intake for the 24 hours leading up to your test. Don't dramatically increase or decrease your water consumption. If you normally drink 6 to 8 glasses of water per day, continue that pattern. If you typically have coffee in the morning, that's fine until your fasting period begins. The night before your test, drink normally until your fasting period starts. During fasting, sip small amounts of plain water only if you're thirsty. Don't force large quantities. The morning of your test, you can have small sips of water to take necessary medications, but avoid drinking large amounts. Remember, your blood test is trying to capture your normal, everyday health status. Dramatically changing your hydration habits gives your doctor a false picture of how your body normally functions. Have you ever changed your water intake before a blood test? Share in the comments what happened with your results. Let's dive into mistake number 4, and this one is absolutely critical because, well, seniors take more supplements than any other age group. It's the supplement stack mistake, and it can make healthy organs appear diseased. Walter, a 74-year-old retiree, was the picture of proactive health management. His bathroom cabinet looked like a pharmacy multivitamins, fish oil, vitamin D, biotin for his thinning hair, vitamin C for immunity, magnesium for sleep, and CoQ10 for heart health. He took his morning handful of supplements religiously, including the morning of his annual blood work. The culprit? That innocent biotin supplement he took for his hair. Biotin interferes with dozens of blood tests, creating false results that can mimic serious diseases. But Walter's doctor didn't know to ask about supplements, and Walter didn't think to mention them because they were natural. Here's what most seniors don't realize. Supplements aren't regulated like medications, but they can interfere with blood tests just as powerfully. The supplement industry targets seniors aggressively, and we're often taking multiple products that can interact with testing in dangerous ways. Biotin is the worst offender. This B vitamin, commonly found in hair, skin and nail supplements, interferes with tests that use biotin streptavidin technology, which includes thyroid tests, hormone panels, cardiac markers and vitamin levels. Even small amounts can cause completely false results for up to a week after stopping. Vitamin C in high doses can interfere with glucose testing, making diabetics appear to have normal blood sugar when they don't. Fish oil can affect blood clotting tests, potentially leading to dangerous medication adjustments. High-dose vitamin D can skew calcium levels, suggesting parathyroid problems. Iron supplements can interfere with multiple tests and should be stopped 24 hours before blood work. B-complex vitamins can throw off individual B vitamin measurements. Even seemingly innocent supplements like turmeric can affect liver enzyme tests. The timing matters too. Some supplements need to be stopped just 24 hours before testing, while others, like biotin, should be discontinued for a full week. Fat-soluble vitamins like A, D, E and K can affect tests for days after stopping. Here's your supplement safety protocol. Make a complete list of every supplement, vitamin and herbal product you take, including dosages. Share this list with your doctor at least 2 weeks before blood work. Ask specifically which ones to stop and when. Don't assume your doctor will ask. Many don't think to inquire about supplements. Common supplements that interfere with blood tests include biotin, which should be stopped 1 week before, vitamin C over 500 milligrams, stop 48 hours before, fish oil, stop 24 hours before, iron, stop 24 hours before, and any detox or cleanse products, stop 1 week before. Remember, the goal is accurate results, not impressive vitamin levels. Your doctor needs to see your body's natural state, not how it responds to a handful of supplements. What supplements do you take regularly? Comment below. Your list might help other viewers identify potential interference issues. Finally, let's discuss mistake number 5, one that's completely invisible but can dramatically alter your blood test results. It's stress and sleep sabotage, and it affects seniors more severely than any other age group. Meet Grace, a 66-year-old widow who was scheduled for blood work to check her heart health and inflammatory markers. The week before her test was particularly stressful. Her grandson was having surgery, she was dealing with a Medicare issue, and she'd been sleeping poorly for several nights. The night before her blood draw, she tossed and turned, worried about what the tests might reveal. But here's what actually happened. Grace's body was responding to acute stress and sleep deprivation, not underlying disease. Unfortunately, her doctor interpreted the results as chronic conditions rather than temporary physiological responses. As we age, our bodies become much more sensitive to stress hormones. The cortisol response that might slightly elevate a young person's blood markers can dramatically spike inflammatory indicators in seniors. Poor sleep, compounds this effect because senior sleep patterns are already disrupted by natural aging changes. When you don't sleep well, your body produces more cortisol, adrenaline, and inflammatory chemicals. These substances directly affect blood sugar regulation, making normal glucose levels appear diabetic. Inflammatory markers like C-reactive protein can spike to levels that suggest serious heart disease risk when you're simply sleep-deprived. Stress affects seniors' blood tests in multiple ways. Cortisol elevation can increase blood pressure readings taken during the blood draw. Stress hormones can affect liver enzyme levels. Inflammatory markers can spike dramatically, and blood sugar regulation becomes impaired. Even anticipatory anxiety about the test results can trigger these responses. The sleep connection is especially important for seniors because we naturally experience more sleep disruptions as we age. Our deep sleep phases shorten. We wake more frequently during the night, and we're more sensitive to environmental disruptions. When we add pre-test anxiety to already fragmented sleep, the physiological impact is magnified. Here's how to manage stress and sleep before blood tests. For 1 week before your test, maintain consistent sleep schedules, going to bed and waking at the same time each day. Create a calming bedtime routine, including warm baths, gentle reading, or soft music. Avoid stimulating activities like intense TV shows or family drama discussions in the evening. Practice stress reduction techniques like deep breathing, gentle stretching, or meditation. If you're naturally anxious about medical tests, acknowledge this anxiety rather than fighting it. Remind yourself that blood tests are tools to help maintain your health, not threats to fear. The night before your test, avoid discussing worrisome topics with family members. Don't research medical conditions online or worry about potential results. Instead, focus on calming activities like listening to peaceful music or doing gentle puzzles. If you naturally have trouble sleeping, consider scheduling your blood work for later in the morning rather than first thing, allowing yourself time to recover from any sleep disruption. Inform your doctor if you've been experiencing unusual stress or sleep problems during the week before testing. This context can help them interpret your results more accurately. For many seniors, the anticipation of medical tests creates more anxiety than the actual procedures. Remember that blood tests provide valuable information to help you maintain your health and catch any issues early when they're most treatable. How do you handle pre-test anxiety? Share your stress management tips in the comments to help other viewers prepare for their blood work. Now imagine the difference these 5 simple guidelines can make in your healthcare. Instead of receiving false alarm results that lead to unnecessary medications, expensive follow-up tests, and months of worry, you get accurate readings that truly reflect your health status. Instead of being prescribed cholesterol medications you don't need, your doctor sees your actual numbers and focuses on real health concerns. Instead of scheduling emergency appointments for fake kidney problems, you receive appropriate care for your actual health needs. When Ruby followed these guidelines for her next blood test 3 months later, her cholesterol numbers dropped from alarming to completely normal, without any medication changes. Charles's follow-up test showed perfect heart and kidney function once he avoided exercise for 48 hours beforehand. Louise's sodium levels returned to normal when she maintained regular hydration instead of overdrinking. Walter's thyroid and liver function became completely normal after stopping his biotin supplement for 1 week. This isn't just about getting better test results, it's about getting accurate medical care, avoiding unnecessary treatments, and having confidence that your health monitoring actually reflects your true condition. When you're over 60, accurate blood tests become even more critical because they guide important decisions about medications, treatments, and lifestyle changes that can significantly impact your quality of life. If this video helped you understand how to get accurate blood test results, please hit that like button and share it with other seniors who need this information. It could literally save them from unnecessary medications or misdiagnoses. Leave a comment telling us which of these 5 mistakes you've made before. Your experience might help other viewers avoid the same errors. For more essential health information specifically designed for people over 60, make sure to subscribe and ring that notification bell.